Good evening, everyone. My name is Dr. Faraz Aldahar. I'm a family physician with the Central Lambton Family Health Team. And I just wanted to send out a plea to our community, our patients, and their families about the evolving situation. Today is Wednesday, March 25th, and it's the evening. And as you may have heard by now, Public Health has announced that indeed Lambton County has 5 confirmed cases of COVID 19. It is my understanding that all 5 of these patients are hospitalized. 2 of them are in the ICU, one of which was in Petrolia. What the public may not appreciate is that there are pending cases, some of which are considered to be positive. So it's out there, it's in Lambton County, and we are anticipating that more people have been exposed and more people are going to be sick. So here's my contributions and my suggestions to myself and to the community at large. First of all, don't panic. We have an incredible healthcare system with physicians who absolutely care and are working around the clock. A public health network that is literally updating its recommendations by the hour. While our system is stressed and while our resources are limited, we are trying our very hardest. And so we implore the community, to those who have thanked us for everything, it is very much appreciated, but our work is not done yet. And we ask everyone to follow the guidance and the suggestions of our healthcare authorities because they have our best interest in mind. Now, having said all that, because of today's news and because of the trends, we are now evolving into a very serious situation. And while this is true across the country, it is now coming true to Lambton County. So, a reminder to myself and to my patients and to everybody who comes to the Central Lambton Family Health Team or has received care at Blue Water Health, please, on behalf of my colleagues, on behalf of all the frontline healthcare workers, please self isolate. I can't stress that enough. If you are a traveler who just got back from traveling during March break, if you are displaying mild symptoms, if you are a family member of one of the patients who's in the hospital, or you believe you may have contact with somebody who shows symptoms, please, please, now is your time to play your role. Now you can help us the most by self isolating. Anybody with mild symptoms, we are strongly, strongly urging that you self isolate at home for 2 weeks. This does not mean congregating with extended family. This does not mean going to shopping or picking up groceries or whatever. Have somebody do that for you. During these times of crisis, we are reminded by the good that is brought out in people, and there are so many volunteers in the community who are willing to help. Use those. But if you are showing mild symptoms, you must stay at home. And for those who are not showing symptoms, who are non travelers, understand that this is now community spread. There is strong suspicion that the patients who are having these symptoms have no travel history. And so we want you to do your part also and to quarantine. So this message goes out for everybody. Whether you've been exposed, whether you have traveled, whether you have family members, stay home. I can't stress that enough because the next 2 weeks are going to be critical. We could be on the same trajectory as some of the other crisis spots around the world. We can mitigate the damage, we can flatten the curve if we do our part by once again staying home. Blue Water Health is doing its utmost, and we strongly urge you that if you have mild symptoms, fever, shortness of breath, sore throat, headache, coughing, please stay home. And if your symptoms intensify, then notify public health or your general practitioner. My colleagues and I are staying at work for you. please help us out by staying at home for us. Until next time, stay safe, stay at home, and Godspeed.